Hello and welcome to the Healthy Living Doesn't Have to Suck podcast. My name is Melissa Allen, and I'm a double board certified lifestyle medicine coach who's dedicated to helping people drop the struggle around creating a healthy lifestyle that lasts. Join me for solo episodes and casual conversations with guest experts in the industry to discuss creating mindset and behavior changes that help you say hello to healthy living made easy, enjoyable, and empowering. Welcome back, Changemakers! I am so excited today to be joined by Dr. DiLorenzo. Her and I actually connected from a mutual contact, so shout out Kristen from the American College of Lifestyle Medicine. So I am very excited to have her here because I can't wait for her to share her practice model with you. She is a doctor. She's board certified in all the things. So I'll go ahead and throw it over to her so she can better introduce herself. Dr. DiLorenzo, thank you so much for joining us today.
Thank you so much for having me, Melissa. I'm super excited to be on the podcast. So I'm a physician. Really, first and foremost, I'm a mom and a wife, and all those roles kind of take precedent over my doctor part. My kids are like Dr. Mom when they're sick or whatever, and I'm like, no, I'm not your doctor. I was like, if you need your doctor, you need to call her.
Right. Yes.
I'm triple board certified, so family medicine is my first and foremost love, and then I got board certification in obesity medicine and lifestyle medicine, and then just a few other things. So I'm a fellow of the American Academy of Family Physicians. So that's kind of like you've gone like above and beyond in family medicine and kind of being recognized for that. I've also done a fellowship in women's health and obstetrics. This is kind of like maternal child health. That's really one of my biggest areas of passion and interest. And yeah, so those are kind of my, certification part of things.
I love that. And you have a practice. It's Zamzam. Am I saying that right?
So yes, I just opened my own practice this year. It's a thank you very much. Labor of love, definitely.
Always when you're a business owner.
Yes. So it's a primary care practice that is membership based. And so what that is I tell people it's great if you have insurance. That's fantastic. You can use that if you have to go to the hospital, the emergency department, labs, imaging, prescriptions, all that kind of stuff. But in order to make it kind of equal for all people, I basically just have a monthly membership rate. I don't bill insurance at all through the office. And then all patients kind of are able to utilize that. So if you get sick and have the flu, I can do that test in the office. Or if you're out of town, I can just send you treatment, if your symptoms match up. So it's a really great care model. I really love it. My patients know me very well and I get to know them very well. And I just feel like this is exactly the way I thought family medicine was really supposed to be, kind of that old school thing of hanging your shingle on the door and it really being your own piece. And I think that attracts people that, are interested in your values and you're interested in taking care of them. And so it's so far, it's been really great. I encourage everybody, if especially if you don't have any access to health insurance, just find a primary medical home. I mean, it's just so important. So.
And yours is direct to primary care. Is that what the model itself is referred to as?
Well, so direct primary care is actually kind of that membership-based model. So if you put in like direct primary care Orlando, hopefully you'll find my practice and some other practices as well that, you can check out. So that's kind of that membership-based model of care itself. For me, actually, I mean, I'm kind of unique in that I do so many different things. So I have the primary care membership by itself, and then I also have an obesity and lifestyle plan. Those patients, I really like to check in with them monthly. And most of them are really on a weight journey and looking at what are their weight loss goals and things like that, or weight management goals. Some people have had bariatric surgery, those types of things. And then just really, maintaining and being the healthiest you could be overall. So some people have watched documentaries recently. Netflix has so many
Oh,
interesting
yeah.
lifestyle documentaries, and people are like a little bit more open to what is lifestyle medicine. So I love to talk to people about that, environmental medicine too. How do you incorporate that in your life? So that's kind of that plan. And then I still am doing my one of my loves, which is OB. So then I also have like a prenatal plan and stuff for those patients as well. So
That's awesome. I love hearing about this because I know before you and I met, I had no idea that there was this direct primary care model where you could pay for a membership and have more quality connection with your provider versus the 15-minute little segments that were billed by insurance that I know is frustrating on the healthcare provider side of things as well. So it's cool to be able to hear about some of these other options that are out there for us to pursue to better support our health. So really excited to hear about that. And I guess kind of continuing along the lines of educating our listeners about, just healthy lifestyles in general. Are there any particular things that you wish people knew about healthy living?
well, I'll kind of tell you about my journey. So being family medicine, I'm kind of just interested in everything, right? So it's really
Yeah.
common a lot of times for family medicine doctors to have like all these different things that they like. I didn't want to give up anything though. Like I didn't want to give up any aspect of a care model. I mean, I guess, there's certain things I did have to give up, like doing inpatient adult hospital medicine because
Right.
there were too many things, right? I couldn't fit them all
Yeah.
into my practice. But that being said, so I what happened was I was seeing a lot of I personally have had my own weight struggles throughout my whole life. And this idea of obesity medicine was becoming really popular. So with the approval of the GLP-1 medications for obesity. And so I was like, okay, well, I want to be on the forefront of this. We don't get a lot of nutrition education in medical school. So most medical schools have, maybe one or two lectures, extremely inadequate amount of nutrition education. And so I felt like I don't have that aspect either as much as I would like. How can I learn more? How can I get additional certifications? And so I did the obesity medicine board certified thinking that okay, I'll really be able to help my patients with that are struggling, with weight management and all these things. And I personally feel like that college did not focus a lot on nutrition. It truly was really more managing obesity with surgery and medications, which is definitely an option. But again, I was like really seeking more knowledge on like, okay, I really want what we call the lifestyle part, right? Which is the
Yes.
diet and exercise and all the things that kind of contribute, to obesity. There's definitely genetic components and things as well, we can say. But I mean, really looking at overall, stress, poor sleep, all the things that so learning more about that. So that was kind of how I, ended up pursuing the lifestyle board. And and I've totally lost track of what do I wish people knew, right? About
Yes. Yes. Yes.
so plant-based diet is the one thing that I really would encourage everyone to at least look into. And, I've had some patients that are hardcore, like, I will never give up meat. You're crazy. Like, I was brought up on like meat and potatoes, and I get it. Like, my husband's family primarily is a lot of meat and rice in their diet. My background is I'm Puerto Rican as well, and so there's a lot of again meat and rice. And so it's hard from a cultural standpoint to really shift your diet in that way. American diet as well. But the health benefits from personally couldn't deny it anymore. The more I was researching and learning and read all these books and publications, I was like, okay, the evidence is overwhelming here. As a physician, I want to practice what I preach. And so I do try my best to overall follow, a plant-based diet. I mean, I have not been perfect. This has been since I
Sure.
started in August 2023. And I think I've had red meat once in that time period, so I really believe in it. And I would encourage everyone to find someone who's supportive of it, or just, kind of doing your own research too and looking at the health benefits there. So that's just like the number one thing that if I could get anybody to change, just adding more vegetables to your diet, adding more fruits, adding more whole foods.
Yeah, absolutely. Because that was, again, I was that person because I'm originally from Texas. So I always say barbecue was like its own food group when I was being raised. And now, I consider myself the flexitarian.
Yeah,
Like I'm mostly plant based, but there are occasions where, we'll enjoy a good steak or, have chicken with dinner and stuff like that. But
right.
the frequency itself has decreased drastically. And so then we have replaced that with a lot more plant-based foods and the whole plant-based foods, because I know
Right.
people also get on the thing
Yes.
about like the Impossible burgers and stuff like that. And it's always like, yes, and it's still a processed food.
Yes. I totally agree. I would say from an environmental and health impact alone, if somebody is just kind of wanting to do a lateral shift, even then I would
Oh,
say
yeah.
choose the plant-based frozen food, because it actually, there's such a huge environmental impact. We know. Again, yeah, I agree. I would love to, myself included, and my kids, nobody eat processed foods, but I know that's just like not the culture in the society we live in. It's
Mhm.
so, people are, we live in such a fast-paced society, and there's so many burdens on moms and on women in general, and I
Mhm.
try not to add to that burden necessarily,
Yeah.
but yes, ideally, if you're looking to make big changes, fast changes, yeah, that's the best thing you can do, is going really, like you said, those really whole foods.
Yeah, and I think a lot of people get intimidated when they hear a plant-based lifestyle, and
Yeah.
I think, to your point, it's just about incorporating more of the
Mhm.
plants. And as you incorporate more of those plants, chances are it pushes out some of the other things like meats and dairies and, kind of those food groups. So I know I've found a lot of benefit in resources like ACLM's. Well, it's the American College of Lifestyle Medicine, for those of you listening who may not be familiar. They have a really great food as medicine jumpstart. That is one that did a really nice job of breaking it down in an easy to follow way with recipes that aren't super intimidating.
Mhm. Menus, yeah, those are
Yeah,
really, can be really easy for someone to just start trying on their own. I
exactly.
personally really love Pinterest, actually, to just
Oh,
look at
yes.
substitutions kind of different, like, cultural recipes. So,
Great
like,
idea.
my husband's Palestinian, and so there's certain recipes that I'm like, "Oh, can I just make this?" Or if somebody else has already done it better, right? So, like, "Oh, can I make this recipe more plant-based?" What can I
Yeah.
substitute in there to make it more, and and just adding beans to my diet. I think I didn't have
Yes.
any beans probably really in my diet before, maybe occasionally like black beans and chickpeas, but now
Right.
that's really become a huge staple. And I think my gut health overall has significantly improved from that. Most people are not getting enough fiber in their
Yes.
diet. So I think that's super important as well. Just looking at not just calories or not just protein. A lot of people will ask
Right.
me how much protein, how many calories. And for people doing weight management, sometimes it is easier to just follow one of those regimens. But if they're open to it, I like to talk about, okay, can we add three more vegetables, three more servings a day kind of thing of this list of vegetables.
Right. Yeah, and having those kinds of things in mind for being able to better promote your health through the food that you eat, because food can be medicine. And when you're looking at, the chronic diseases that are out there, I know lifestyle medicine can actually use food as an intervention for some of these conditions like type 2 diabetes, obesity, cardiovascular disease, hypertension, all of those things that are related to the way that we live. And for those of us who may not be the most at risk of developing those or don't necessarily have the family history, don't have any of those precursors, even programs like I loved the Full Plate Living program from the Ardmore Institute because
Mhm.
it was focused on fiber and just like how can you even just think about your plate differently, where, the meat and potatoes isn't the main star of the dish, but rather just like the accessory. And then the plants are really that main star. So that was something that I found a lot of benefit in. And I think, that kind of tags nicely into our empower section, which is usually where it's like, what questions could people ask themselves to feel a little bit more empowered around starting this healthy lifestyle journey? So, can you share with us a little bit about, what are some of the things we could ask ourselves to recognize the importance of being more proactive and preventative with our health?
Well, I really would encourage people to look at change as growth. And so I
Mm.
think that, if you are
Oh, I love that.
changing things in your life, a lot of times you're moving towards growth. And because I found that, recently as like being a business owner now and having my own practice and things, and change is really scary, right? What you
Mhm.
know is easy, getting those potato chips, getting, certain comfort foods, macaroni and cheese, what we know is really easy and convenient, right? And change can be hard and scary, but it's definitely one of the best things we can do. We from your brain health actually, when you're
Mhm.
making change, right? When you're changing up your physical activity sometimes, right? When you kind of hit
Yeah.
that plateau that a lot of like people are like, "Oh, I'm not losing weight anymore." I'm like, "You probably need to change it up now. You need to like work with a trainer or let's look at what you're doing and kind of see where we can revamp things." So I would just lean into change, and I would
Mhm.
encourage that. That's kind of my empowerment. And then really small changes add up. So when someone mentions whole food, I hope I didn't scare anybody away by saying, whole food plant-based diet, but like just in that when I say that, I mean sometimes just adding more vegetables to your day. If your serving right now is 0 vegetables a day, which is really common. I mean, I looked at my
Yeah.
diet back in August and I was like, I ate 0 fruits this entire week. I ate 0. I mean, I gave my kids lots of nice whole fruits and stuff, but
Right.
personally, I had 0 whole fruits in a whole week. And I was like, how did it get to this point? How did like
Yeah.
I love fruit. That's not really like me, but just, living in a busy kind of fast-paced society, um, again, of course, putting my kids first, putting my pets first, whatever. So it just I wasn't making a priority for myself. So now
Mhm.
I really do like Dr. Greger's app, the Daily Dozen,
Oh,
because for
nice.
me, I
Yeah.
like sometimes when I fall off track, using kind of little check boxes can help me get back on track. So, like, it's just a little app that's like, did you eat this many of fruits, this many vegetables a day, kind of, and then making sure you kind of have a variety in that of looking at particular kinds of vegetables that are more healthful. And then
Mhm.
that's more we're talking about too, not just weight management, but decreasing cancer risk and increasing longevity and all those kind of foods. Like you said, food as medicine that can help with that. So just any little changes, give yourself credit. I think we're really hard on ourselves sometimes, and small changes matter.
Yeah, absolutely. I love how you said change is growth. That was something where I was like, ooh, I'm taking that one away from this episode because it's so true. And I think people can view change as scary or,
Yeah.
intimidating. But I think if, they follow what you were sharing and just taking those small steps that over time add up into that larger lifestyle transformation, that can help it to feel more accessible and also exciting at the same time too, where then you look back and you see how far you've come and you're like, wow, I didn't have to overly drastically overhaul my life overnight like a lot of people think you
Yes.
do. it's it's just adding in those better things that are going to promote our health. And when it comes to monitoring our health, can you share a little bit more about, what are some of the things that we can do to make sure that we are taking care of ourselves? Like you said, you're really good about taking care of the pets, the kids, everyone else in our lives, and I know some of our listeners are going to relate to that. So what are some ways that we can also make sure we're prioritizing taking care of our health?
Well, I can't tell you how many people miss their annual physical. It
Sure.
becomes a biannual, and then it's,
Yeah, every other
every
year.
3 years, every 4 years. So that one thing alone, I think, can really help. Now, I will tell you then at that physical, most people do need another exam or another check-in. I mean, if you're coming to your physical exam to your doctor with like 20 problems that you've been holding on to, for 2 years,
Yeah.
then you need more follow-up, and I would encourage you to find a doctor that listens, that, a medical home where you feel comfortable. So I have a direct primary care doctor myself because I really believe in this care model, even though I have health insurance and all those things. But I don't have time to wait to go to the doctor. I don't want to sit in a waiting room for an hour or two. My mom recently shared with me she sat in a waiting room for like 3 hours or more. She basically lost track of time for an appointment with her doctor. And I'm like,
Yeah.
that is crazy. Like, she was like, yeah, it was
Yeah.
like super dark when we left. It was like nighttime and we went in, it was day. I was like,
Yeah,
so
that's not good.
yeah, yeah. And sometimes, I mean, what I love about my direct primary care model also is like sometimes someone just has to ask me a quick question. They really just have something quick that they're just wanting to check in with. And I'm able to respond and address that. I unfortunately, the healthcare system, the insurance model, it's like if you have an issue, then that comes up, you might need to come in for an office visit so your insurance can be billed and all that because
Mhm.
phone call visits may not count or text message visits may not count. And with my system, it doesn't matter. You can call me,
Yeah.
text me as many times as you want, and I'm still going to take care of you the same. And, most people don't want to call and text their doctor continuous. Like
Right.
they
Yeah.
want they want, whatever their issue is handled, and then they don't
It's like,
really
okay,
want to.
thanks.
Yeah, yeah, exactly. It's not really a social. So I think just, encouraging people to definitely see your doctor at least once a year, but really if you're
Mhm.
coming with a lot of issues, kind of already have in your mindset that you may need more than that. You really need to set up a care plan with them and be like, "Hey, I would really like to follow up with this in 2 months or 3 months, or
Right.
how long do you think I should come back and follow up?"
Yeah. Yeah, absolutely. Oh, that's such great advice because now you've got me thinking, ever since I switched jobs, I'm like, did I get a new primary care provider that's like coming up on 6 months maybe? So I'm like, yeah, I'm probably getting close to the time where I'd be due for even my personal annual check-in. So
Yeah,
so
that
thank you
that
for that reminder.
that issue is just only really looking at we just wanna look at all your health screening stuff, like your
Right.
mammogram, your pap smear, your whatever, your lab work, we all many people often don't have the time, unfortunately, to address
Mhm.
problems in that visit too, and really
Yeah,
and that's the most honest part of it. I mean, I have 1 hour, a full hour with my new patients,
that's
or
amazing.
for
Yeah.
the physical exam kind of thing or whatever, so that's pretty unique.
Yeah.
Most in the insurance-based system don't have that kind of time.
Mhm.
So,
Yeah, that's so true. So as we're, letting the listeners kind of process all this amazing information, they may be wondering, like where can I even get started with making these changes? So when it comes to engaging in what we've already been talking about, I know we've shared a couple of resources as we've gone along, which I'll make sure to link in the show notes too, so that way they have easy access to find it. But what are some of those first steps that you would encourage people to take when it comes to trying to start that journey towards healthier living?
um, hmm, such a good question. Well, obviously, I'm a resource for my patients, so if you're interested in becoming a patient, you can go to zamzamwellness.com, and you can find out more information about my practice and all those kind of things. So and I love to give patients lots of resources, so that's why I'm actually struggling right now because 'cause I'm like,
Right.
if I just had to pick a couple of things, what are my favorite?" And I'm like, "Oh, I have so many." So, yes, obviously, so me, and then probably the next thing, since we talked really a lot about plant-based diet and things, would be the American College of Lifestyle Medicine. I mean, they're really have a lot of great resources for patients or finding a doctor who is board certified in lifestyle medicine, or a health coach who is boarded in the lifestyle medicine as well. So all these are great resources. Obviously, your podcast, because this is a main part of your platform and everything. I was trying to think of what else. Yeah. And then really finding a primary care doctor, I think we can trust. I think that's an invaluable resource. I was going to say, oh, and then I mentioned, Dr. Greger's app. I really love Dr. Greger, Michael Greger. He has written so many books on lifestyle medicine. And I mean, these are huge books, like textbooks. And because he puts in all the references. So his books actually would be a great kind of jumping off point. So personally, I had heard of Dr. Dean Ornish, who's one of the founders of lifestyle medicine many years ago. I was in medical school. I read his book. I was like, this is the way, right? At that time, I was like, this is the way. Then my husband, you kind of forget or whatever. You get passionate and riled up about something, and then you're like, oh, and it
fizzles out. Yeah.
Life changes, you have children, whatever.
Right.
Then my husband had picked up Dr. Greger's book. It was How Not to Die, I think was maybe his first one. And because he was concerned about overall, cancer risk and these types of things. He's like, you have to read this. You have to read this. That went on for probably about a year. Finally, I think I got to it, and I'm like, yes, this is the same.
We're back, baby.
This is the way. And then I was like, finally, I was like, oh, I'm going to do this certification. And, and you hear all these people speak at the lifestyle medicine conferences and stuff, and they're just such amazing resources. And so I think, some of their books are challenging, I think, if you're not in the medical field, but you can kind of pick and choose their books are so big. So you could probably and Dean Ornish's are a little bit, I think, more direct to his patients too, that there's some that are you can kind of pick the parts that you're interested in as well, or if you have a family history of diabetes or all those kind of things. So I think those are great. And I love the library. It's library is free. We pay for that with our tax money. And so I always encourage patients, if they're not members of the library, use your library. You don't have to pay a lot of money for starting these things and getting all these books and stuff. Just there's free audiobooks, free text or regular books, so use that.
Oh, I love that so much. And especially when you were talking about, finding a primary care provider that you trust and feel comfortable with, because ultimately there may be some things going on underneath the surface that we're not aware of until you go and get things like your blood work done. And that might totally change your life, where you didn't realize that you had to take this on at more of an intensive level to prevent the development of things like prediabetes and whatever else may be in your family history, or because we're all more sedentary than ever, maybe we just get moving more. So I love that is a starting point that you recommended, because that could be the game changer in finding the motivation to follow through with some of these changes that maybe you've been thinking about making, but weren't necessarily excited about. And then it's like, oh no, this needs to happen.
Right. Yeah. No, that's a great point.
Awesome. Well, we've been wrapping up all of our guest episodes by asking, what does healthy living doesn't have to suck mean to you, or how do you bring that into your life and your work?
So again, the small changes, I think. So I don't want to say I hate exercise. Let me change that. I was going to say I hate exercise. I love exercise. I hate, finding the time and fitting it in and all those kind of things. And so I enjoy fitness classes, because one thing I tell a lot of women about is strength training. Strength training is super important, right? And I have to tell myself every time I tell a patient, I'm like, oh, you got to do your strength training too, right? Because I'm like, you don't like doing it. So I think that just sometimes there's things that we may not really care for, but finding a way to make it fun, really. So I love walking. I can walk forever. My office is really close to Mead Gardens. And so if I have a chance, I will just go take a walk and go enjoy, beautiful Mead Gardens. And the same thing with weight training. I hate regular gym type weight training or whatever. But if I'm doing it in a fitness class, I'm super motivated. I love doing it in a group. So I think just finding what's going to continue to motivate you to do something. So, and I think again, small changes. If you just start saying you're not going to the gym at all and you say, oh, I'm going to go 7 days a week, well, it's probably not going to happen. And then you're going to constantly feel like bad when you haven't reached that maybe not great goal that you set for yourself. So just
Right.
like, okay, I'm going to, 1 day a week, or I'm going to do this
Yeah.
fitness class at home 1 day a week. I love small long-term changes better than anything. And we know that that's the most important for long-term health outcomes too. So
Yeah. Yeah, absolutely. Because when you try to go all in, it may be short lived. You may, hit those 7 days the first week, but then week
yeah.
two rolls around and you're like, oh, I'm kind of running out of steam here. So
Yeah. And,
I
and
love
almost
that.
everybody's personality is different. I mean, maybe some people
Yes.
it's all or nothing and they will continue to do well with that. But majority of people I would say are not going to continue to like
Yep.
if they start something hardcore like that, are not going to continue to do that. So
Yeah, chances are if they're listening to this podcast, they're more like me, and I am not the all or nothing person that is
right.
successful. So we need those other reminders that those small steps do add up over time, and that's so important. Oh my gosh. Well, Dr. DiLorenzo, thank you so much for joining us on the podcast. I know you shared your website earlier, but where are some other places that our audience can connect with you?
So Instagram, so I'm at Zamzam Wellness _DPC. I'm also on Facebook, just Zamzam Wellness. Where else? I said my website, and then my email contact info is on my website at the bottom if you're interested. And I love teaching and things too. So if there's anyone that is looking for someone to speak to an audience, teaching, community events, those kind of things, those are super important to me as well. And I love to participate in that. And I teach, medical students and residents and things like that as well. So
Awesome. Well, thank you so much for sharing your time with us today. It was such a pleasure to have you on, and I'm so looking forward to our listeners getting to experience this episode because I'm sure that they're going to walk away with lots of value from it today. So we really appreciate you.
thank you again, Melissa. It was great to be on. I'm so happy I got to share this with you guys.
Awesome. All right, change makers, keep it real, kick some ass with your goals, and we'll catch you next time. I hope you all enjoyed that episode as much as I enjoyed recording it. And don't forget to grab your freebie with the wellness wheel at healthylivingdoesn'thavetosuck.com/wellness so you can get started on your changemaker journey today. As always, thanks so much for listening, changemakers. And if you can please remember to head to your favorite podcast platform and subscribe, rate, and review. It will help this podcast reach other changemakers so they can start listening and tuning in each week. As a quick, friendly reminder, the information in these podcasts are always strictly for educational purposes only. Thanks so much for tuning in, and I'll catch you next time.